If you're seeing someone going to hospital lots of times or really taking a long time to recover from a hospital admission, they're an ideal person to refer.
As our local population lives longer, may develop frailty, we know that people need holistic and comprehensive review to be able to live as well as they can for as long as possible.
So the Ageing Well MDT here in Barnet is, I think, a really good example of the sorts of services and the way we'd want to better organise our financial and human resources across the NHS to deliver to the needs of the population. So in identifying people who might benefit from the service before they become poorly or before they become more poorly, it can get in, work with people to develop a care plan, to review their housing and their wider social determinants, and put in place a management plan and some specific interventions to make sure that they stay healthier, more independent for longer.
So we have consultant geriatricians, psychogeriatricians, district nurses, occupational therapists, physiotherapists, but we also have a fantastic input from Age UK and from our council teams to really look at the wider determinants of health and what the blockers are for this particular patient.
The council commissions the voluntary sector services that those residents are referred to. The council provides adult social care support, housing advice and support help people adapt their homes so they can stay in them.
And we've seen about 500 patients. So we can support somebody with all the different issues that come with ageing, because getting older doesn't come with a manual, and particularly for people who are living with different long-term conditions or with other non-medical determinants of ill health, such as financial issues or loneliness and isolation.
Before, we used to have to do multiple referrals across many different agencies and wait for responses, by which time sometimes the resident will have been admitted to hospital. Now the care is much quicker and it's coordinated across organisations, and it's a dialogue where we can create a perfect care plan for the patient.
I care for my mum, who is 91, and she has several kind of health conditions. Going to hospital is more and more onerous for my mother. We'd always have a list of appointments and you'd never seem to be free of appointments. So I suppose what this allows us to do is to care for my mother in her own home, where it is her favourite place of care, through the GP, where we have access then to other health professionals.
So to be able to provide the assessment and intervention that's needed, listen to the person in front of us, focus on really what matters to them at this point in time in their life, but also look at everything around them, whether that's loved ones, their carers, the support that they're receiving.
Since 2015, I've had issues with my spine and multiple operations, and since then the local doctors have been helping me with my medication.
So it's a great service. It provides really comprehensive support for people with multiple health needs and their carers.
I'm so proud of the joined up working that happens across our traditional service boundaries, and really being able to see the impact on individual patients and their loved ones is really rewarding.
So it really feels like we're in a team trying to find the best way of caring for my mum in the best place, which for her is at home.
So we've developed over the past year a really consistent and coherent model of care for Neighbourhood Health, and to ideally stop people becoming unwell in the first place, to respond to them much more quickly before they become more unwell, and also for tailoring services to people's individual needs and requirements.
And they really provide a fantastic service which supports them to stay active and healthy in their home.
That's really what's helpful. It's brilliant.
What we want to do now is make sure that that service and that approach is extended across all parts of Barnet through our neighbourhood model work.
The other areas we're working in our role as a strategic commissioner, so we're understanding how we use our limited resources across North Central London, making sure that the neighbourhood model that we're developing through partnership is supported and is sustainable and is at a suitable scale to deliver for the people most in need across North Central London.